High blood pressure is frequently referred to as the silent killer, and rightly so. It causes no pain and often displays no clear symptoms. For numerous older adults, it develops silently over time until a significant incident such as a stroke or heart attack reveals its presence. What further amplifies its risk is the ease with which one can ignore the daily habits that feed into it. Day by day, these are seemingly minor decisions. Your diet, your physical activity, and your stress management techniques significantly impact your blood pressure, perhaps more than you're aware. The reality is that numerous individuals over the age of 50 are seemingly doing everything correctly. They consistently take their prescribed medications. They attend regular medical appointments and strive to remain physically active. However, subtly embedded in their daily routines are minor, frequently unnoticed errors. These are seemingly innocuous habits that gradually increase blood pressure or disrupt treatment effectiveness. Unless identified, these issues persist, subtly exerting pressure on the heart, brain, and whole circulatory system. That's the importance of this video. Our aim is not to bombard you with complex medical terminology or to make you feel guilty for any missteps. We're here to provide clear insights and illuminate the most frequent blood pressure errors made by seniors, while suggesting straightforward, actionable adjustments that can truly impact your health. Whether you've been dealing with hypertension for a long time or have only recently started monitoring your blood pressure readings, this guide aims to empower you to regain control over your well-being in a manner that's achievable, supportive, and intelligent. Managing blood pressure involves more than just tracking figures on a monitor. It's about remaining active, maintaining clear thoughts, achieving good sleep, and living life confidently. This begins by understanding what to avoid and what actions to take instead. Now, let's explore the initial mistake related to blood pressure and begin to construct a robust, more reliable base for your cardiac health, one intelligent habit at a time. The first mistake is either skipping medications or taking them improperly. Treatment for high blood pressure usually begins with a prescription. Medications are among the most potent methods available to maintain blood pressure levels, but their effectiveness hinges on their being used accurately and regularly. One of the most hazardous and sadly frequent errors that older adults commit is missing doses, consuming medications at incorrect times, or discontinuing drugs without consulting a healthcare professional. It's a practice that may appear minor initially, but it can lead to severe outcomes as time progresses. Several factors contribute to this issue. Some individuals forget. Others feel well and believe they no longer require the medication. Some are concerned about potential side effects, or they are uncomfortable with the notion of relying on a pill. Some people also split their pills or take them every other day to extend their prescription or conserve funds. While these actions might seem justifiable, they can result in blood pressure variations that burden the heart and heighten the risk of stroke, kidney damage, or heart failure. Blood pressure medication is precisely tailored to your body. It's not solely about lowering a figure. It's about safeguarding your entire cardiovascular system. When doses are skipped or taken inconsistently, blood pressure can surge unexpectedly. This increase may not seem noticeable initially, but gradually it silently harms the arteries and imposes additional strain on essential organs. Since symptoms seldom appear, numerous individuals remain unaware of any issues until an emergency arises. It is particularly critical to recognize that medications for blood pressure frequently do not generate a sense of well-being as other medications might. You might not always feel an immediate improvement after taking them, and this can lead to undervaluing their significance. However, they are performing essential tasks in the background, alleviating the strain on your heart, enhancing blood flow, and lowering your chances of severe complications. Fortunately, this oversight is entirely avoidable. The initial step is to establish taking your medication as a routine rather than an option. Consistently take it at the same time each day and utilize tools such as pill organizers, alarms, or daily checklists to help you remember. If you happen to skip a dose, avoid taking an extra one without first consulting your doctor. Reach out for advice. If you're encountering side effects, mention them immediately. Frequently, there are alternative medications or modified dosages available that can improve your well-being without compromising your cardiac health. Additionally, do not cease taking your blood pressure medication simply because your readings appear normal. This is usually an indication that the medication is effective, not a justification to discontinue use. Always speak with your physician before altering your regimen, regardless of the change's perceived insignificance. Minor changes in the timing or amount of your medication can affect its effectiveness. It's also important to talk to your healthcare provider about any concerns regarding cost. Many older adults try to extend their prescriptions due to expenses. However, there are usually generic options, discounts, or support programs available that may assist. Your well-being is worth discussing. Controlling blood pressure requires long-term dedication, yet it's an endeavor that enhances your vitality, steadiness, and tranquility. It all begins with consistency. One tablet, one day, one choice at a time. Your heart relies on you to remain consistent, and so does your future. Mistake number 2, consuming hidden sodium. You might not be grabbing the salt shaker during every meal, but that doesn't mean you're steering clear of sodium. Actually, the majority of the salt in an older adult's diet isn't added at the table. It's concealed within the foods we consume daily. A frequent and often overlooked error in managing blood pressure is underestimating the amount of sodium that creeps into your diet. Consuming high levels of sodium is directly associated with elevated blood pressure. Salt leads the body to hold on to water, which raises the amount of blood in your blood vessels and places additional stress on the walls of your arteries. Over time, this stress can strain the heart and may result in stroke, heart attack, kidney damage, or other severe health issues. However, since the effects are not immediately noticeable, it's simple to overlook and even simpler to forget where salt is concealed. Processed foods, including canned soups, various sauces, frozen meals, breads, processed meats, and even options that appear healthy, such as low-fat salad dressings or whole grain crackers, often contain high levels of sodium. Sodium is not only used to enhance flavor, but also to preserve these foods. Even products marked as light, diet, or heart healthy can have significant amounts of salt added to extend their shelf life and improve taste. And as these foods become regular choices due to their convenience, ease, or familiar flavors, sodium levels can quickly accumulate. For older adults, this problem is particularly significant. With age, our kidneys lose some of their ability to filter sodium, making the body increasingly susceptible to its impacts. This implies that even a moderate intake of sodium can cause more significant rises in blood pressure than it would have years ago. It also heightens fluid retention, potentially exacerbating issues such as leg swelling or congestive heart failure. The initial step to rectify this error is awareness. Begin checking labels, not only for calories or fat content, but also for sodium levels. You might be astonished to discover where it lurks. Just one serving of canned soup can contain over half of your daily recommended intake of sodium. Even a piece of bread or a bowl of cereal can add substantial amounts if eaten consistently. Look for items marked as low sodium with less than 140 mg per serving, or no added salt whenever feasible. Simple measures can also have a significant impact. Rinse canned beans and vegetables to remove excess sodium. Opt for fresh or frozen foods without added sauces. Prepare more meals at home to have control over the ingredients. Incorporate herbs, spices, lemon, vinegar, garlic, or pepper to enhance flavor without adding salt. Gradually, you'll discover that these alternatives not only safeguard your heart, but also improve the taste of your dishes. Remember, adjusting your palate to enjoy these flavors takes time. If you've been accustomed to salty foods for a long time, options with less sodium might initially taste a bit flavorless, but your palate adapts. After a few weeks, you'll begin to notice the natural flavors of foods more distinctly, and you might discover that foods with a lot of salt start to seem too strong or disagreeable. Reducing sodium intake doesn't equate to sacrificing pleasure. It involves selecting a route that enhances your health, safeguards your heart, and enables you to live with greater clarity, energy, and stability. Each bite is a step towards equilibrium. And every meal is a chance to feed not only your hunger, but also your overall well-being. Mistake number 3, failing to regularly check your blood pressure. Blood pressure isn't something you can sense, at least not until it reaches dangerously high levels or leads to a severe event. This is what makes it particularly deceptive. You might be enjoying your day, feeling well and in good health, yet your blood pressure could be silently increasing. For older adults, a frequent and dangerous error is failing to regularly check their blood pressure or depending solely on yearly checkups with their doctor to monitor it. Without regular checks, minor fluctuations can go undetected. Even minor variations can result in significant effects. The truth is that blood pressure fluctuates during the day, influenced by factors ranging from stress and sleep to your diet and activity level. A solitary measurement taken at the doctor's office, though it may appear ideal, does not provide a complete picture. And often, those clinic readings can be inaccurately high because of anxiety or inaccurately low if you're having a particularly good day. This is why home monitoring is so effective. It provides a more comprehensive view of your blood pressure patterns over time, and that understanding could be life-saving. If you're not monitoring your blood pressure, you're overlooking crucial indicators. Perhaps your medication is no longer as effective. Perhaps a recent change in your diet or a new source of stress is beginning to affect you. It's also possible that a supplement you've started taking is conflicting with your prescribed medication. Without consistent monitoring, you're left to speculate. When it comes to your heart health, you can't afford to make assumptions. Regularly checking your blood pressure at home is an easy and effective practice to adopt. It enables you to identify trends, detect early increases in pressure, and provide your physician with the information necessary to make informed decisions. It also assists you in taking control of your health. You're not merely waiting for outcomes. You're actively influencing them one measurement at a time. You don't require sophisticated devices or medical expertise. Modern home monitors are budget-friendly, simple to operate, and typically feature large, clear displays and integrated memory. Consistency is essential. Choose a consistent time each day, such as early morning or late afternoon, to take your measurement. Always do it at the same time. Before measuring, sit quietly for 5 minutes. Keep your arm resting on a table. Place both feet firmly on the ground and refrain from speaking while the measurement is taken. Consistently doing this daily provides a precise, truthful snapshot of your body's performance. It's crucial to maintain a record, either on paper or through a digital application, and take it with you to all medical appointments. Keeping such records enhances the efficiency of your appointments, enabling your healthcare provider to identify changes, modify medications as necessary, or detect early warning signs before they develop into significant issues. Some individuals shy away from monitoring due to fear of discovering concerning results. They are concerned that a high reading might lead to stress or anxiety. However, the reality is that neglecting your blood pressure doesn't safeguard your health. Instead, it allows possible issues to develop further without any control. Being aware is the initial step towards making positive changes. Monitoring your blood pressure is crucial for early detection. It's not merely an item on your to-do list, it represents a continuous dialogue with your body. Just as with any fruitful discussion, It is most effective when conducted consistently, peacefully, and thoughtfully. Incorporate it into your daily routine, turn it into a regular practice, and most importantly, prioritize this because the decisions you make today shape your future. Mistake number 4, neglecting to manage stress. Stress is not only an emotional sensation, it is also a physical burden that your body bears. And while it's common to link high blood pressure with unhealthy eating habits or insufficient physical activity, one frequently overlooked factor is ongoing unrelieved stress. For older adults, neglecting to manage stress is an error that impacts not just mood and sleep quality, but also steadily and silently elevates blood pressure over time. Stress triggers the body's fight-or-flight mechanism, releasing a surge of hormones such as adrenaline and cortisol into the bloodstream. These substances temporarily elevate blood pressure by constricting blood vessels and accelerating heart rate, a typical short-term response. However, when stress becomes a regular occurrence rather than a sporadic event, your body begins to maintain that elevated state. Your arteries stay narrowed. Your heart exerts more effort. As time passes, this continuous strain causes damage that medication alone may not always repair. The challenging aspect is that stress frequently remains unnoticed in everyday situations. It isn't always expressed as panic or outbursts. At times, it's more understated. There might be tension in the shoulders, a feeling of tightness in the chest, a night of restless sleep, or a silent sense of being overwhelmed. And because many older adults come from generations where the norm was to persevere or remain resolute, it's common to minimize or even disregard these feelings. However, neglecting stress doesn't eliminate it. Instead, it allows more time for the stress to embed itself deeper into your system, sapping your vitality, reducing your tolerance, and subtly increasing your blood pressure. The positive aspect is that managing stress doesn't necessitate severe alterations or costly treatments. It begins with minor, deliberate steps that soothe the nervous system and restore equilibrium. For instance, deep breathing decreases the heart rate and eases the blood vessels. Engaging in gentle activities such as walking, yoga, or stretching can alleviate tension and trigger the release of mood-enhancing endorphins. Spending quiet moments in nature, enjoying music, or engaging in gratitude practices like journaling or prayer can help recalibrate your stress response. Additionally, conversing with a friend or openly sharing your feelings can also reduce emotional burdens. The goal is to develop a routine of daily stress management. It's not only about responding when situations become challenging, but also about establishing habits that allow your mind and body time to relax. Consider it akin to brushing your teeth. It's not solely for moments of pain, it's also about preventing issues before they begin. And if you've been enduring unmanaged stress for an extended period, remember to treat yourself with compassion. This isn't about pointing fingers. It's about identifying opportunities for improvement and making incremental changes. You don't need to solve all problems at once, but by starting to allow room for tranquility, contemplation, and nurturing, your body will react positively. Not only does stress impact your mental state, but it also affects your blood pressure, your sleep patterns, your digestive health, and your general sense of tranquility. While stress might be unseen, its consequences are certainly tangible. Remember, the ability to control it is always accessible. One breath, one stroll, one moment of calm at a time. Mistake number 5, overlooking physical inactivity. In the management of high blood pressure, the actions you avoid can be equally crucial as those you undertake. One of the most commonly underestimated yet significant errors older adults commit is neglecting physical inactivity. In simpler terms, spending too much time sitting, not enough time moving, and believing that rest is invariably the optimal solution. Although rest is important, insufficient activity can gradually and silently elevate blood pressure and force the heart to exert more effort than necessary. Physical activity aids in regulating blood pressure by fortifying the heart. A reinforced heart can pump a greater volume of blood with reduced effort, which diminishes the pressure on your arteries, helping to maintain your levels within a healthy range. Additionally, exercise enhances circulation, diminishes inflammation, assists in managing weight, and reduces stress. All critical elements in cardiovascular well-being. However, when physical activity is absent from everyday life, the body begins to decline in efficiency. Muscles become weaker, blood flow decreases, and pressure within your blood vessels starts to increase. For numerous older adults, the issue isn't a lack of motivation, it's uncertainty. Worries about joint discomfort, tiredness, or the fear of falling can make the concept of exercise seem daunting. However, physical activity doesn't need to be intense to be beneficial. Even mild activities, when performed regularly, can yield significant advantages. A simple daily stroll around the neighborhood, doing some stretches each morning, or performing gentle seated exercises while watching TV can all contribute to getting your heart rate up and improving circulation. Indeed, one of the most effective adjustments you can make is to simply reduce your sitting time. If you often find yourself watching TV or reading for extended periods, consider standing every 30 to 60 minutes. March on the spot for a minute. Head to the kitchen and perform some shoulder rolls or toe taps. Engaging in these brief periods of activity during the day can interrupt extended sitting durations, which may otherwise lead to stiffening of the arteries and increased blood pressure over time. Consistency is key. Regular physical activity signals to your heart, blood vessels, and brain that you are actively participating in life, remaining vigorous and robust. Over time, this message manifests into reality. It's equally crucial to discover types of physical activity that you find enjoyable. This could include dancing, gardening, water aerobics, or a gentle stretching session in the morning sunshine. When exercise is enjoyable rather than burdensome, you're more inclined to maintain it consistently. As it becomes a regular part of your routine, your body starts to flourish. If you're uncertain about how to begin, consult your doctor or a physical therapist. They can assist you in finding safe and suitable methods of exercise tailored to your current health and mobility levels. Keep in mind, the goal here isn't to turn you into an athlete. It's about maintaining independence, preserving your stability, and supporting your heart so it can continue to function well for many years ahead. Overlooking a sedentary lifestyle might seem benign, but as time passes, it imposes undue strain on your heart and circulatory system. Physical activity acts as a therapeutic agent, and every movement you make contributes to reducing your blood pressure and building a stronger, more assured you. Error number 6, excessive consumption of caffeine or alcohol, a morning cup of coffee, an evening glass of wine. These simple pleasures are everyday habits for numerous individuals, and when used sparingly, they indeed provide comfort. However, for older adults managing high blood pressure, the excessive consumption of caffeine or alcohol can be an oversight that's easily missed. These substances might not appear harmful initially, but they can subtly increase blood pressure, disrupt the effectiveness of medications, and lead to more health problems than they prevent. Let's begin by discussing caffeine. Caffeine, a common stimulant, is present in coffee, tea, soft drinks, energy drinks, and even chocolate. It works by constricting blood vessels and boosting heart rate, both actions that can temporarily raise blood pressure. For certain individuals, this impact is either slight or fleeting. However, for some individuals, particularly those who already have high blood pressure or an increased sensitivity to stimulants, even a minimal amount of caffeine might elevate their blood pressure to risky levels. The challenging part is that this reaction differs significantly among individuals. Some older adults can consume a daily cup of coffee with no problems, while others might see their blood pressure rise for an extended period, often without even noticing it. Awareness is crucial. If you regularly consume caffeine, it's important to observe how your body reacts. Think about measuring your blood pressure both before and after you enjoy your morning coffee or afternoon soft drink. If you observe consistently higher measurements or experience symptoms such as headaches, feeling shaky, or a rapid heartbeat, it may be advisable to reduce your intake or opt for decaffeinated versions. There's no need to completely abandon your cherished routines. Simply make mindful changes that benefit your heart. Alcohol poses a unique challenge. In moderate quantities, it might appear to aid in relaxation, easing your defenses after a taxing day. However, when consumed in larger or more regular quantities, alcohol elevates blood pressure and can greatly hinder the performance of drugs prescribed for managing hypertension. It also leads to dehydration, disrupted sleep, weight gain, and heightened emotional stress, all factors that adversely influence blood pressure. For older adults who metabolize alcohol more slowly, these effects can be more pronounced and persist longer than anticipated. Consuming more than one alcoholic drink daily can move the scale from rare treat to persistent danger. Additionally, mixing alcohol with medications for high blood pressure may cause various side effects such as dizziness, confusion, and liver stress. These dangers increase significantly when additional medications are involved, which is commonly the case for older adults who are treating several health issues. The positive news is that even modest moderation can have a significant impact. Reducing your intake of caffeine or alcohol can result in decreased blood pressure levels, enhanced sleep quality, more consistent energy throughout the day, and better concentration. In certain instances, cutting down on these substances may also lessen the requirement for extra medications. Abandoning coffee or wine doesn't equate to forsaking comfort. There are numerous pleasant, heart-healthy alternatives available. Consider trying herbal teas such as chamomile, mint, or rooibos. Enjoy a warm lemon water or create your own flavored sparkling water using fresh fruits and herbs. These easy substitutions can provide the same feeling of routine and relaxation without any adverse effects. Ultimately, it's about making healthier choices, not about restricting yourself. It's about intention. Understanding how caffeine and alcohol impact your body enables you to make more informed decisions. Decisions that benefit not only your blood pressure, but also your overall health and quality of life. Your heart does not seek perfection. It seeks care. And every step you move toward balance is a step toward a more robust, more stable you. Error number 7, failing to communicate with healthcare providers. In the management of high blood pressure, it's equally crucial to have a solid support system as it is to take the correct medications or follow the right diet. And at the heart of this support system is your healthcare provider. However, a frequent and preventable error among seniors is the failure to maintain open communication with their doctor or healthcare team. This may include missing scheduled appointments, not reporting symptoms, or assuming that their health is satisfactory. Without honest and consistent conversations, there can be overlooked chances for improvement and unheeded warning signs. It's common to settle into a pattern of just renewing medications and attending yearly examinations. However, blood pressure isn't a static condition. It varies with shifts in stress, activity levels, sleep patterns, diet, other medications, and even seasonal changes. If your doctor isn't completely aware of your daily experiences or how you are feeling, they are only seeing part of the overall situation. This can make it challenging to identify issues promptly or to adjust your treatment effectively. Many older adults refrain from voicing concerns due to worries about being perceived as troublesome, facing judgment, or inconveniencing their doctor. However, no issue is too minor when it concerns your health. Whether it involves unexpected dizziness, a side effect you've been overlooking, a new supplement you've begun, or a change in your daily activities, sharing all these details assists your healthcare provider in maintaining a care plan that is both safe and effective. Side effects from medications are among the most frequently underreported problems. Many individuals discontinue their medications due to unpleasant feelings without discussing these issues with their doctor. This can result in unmanaged blood pressure or, more severely, serious complications. A brief discussion could lead to a modified dose, an alternative medicine, or lifestyle adjustments that significantly improve your situation. It's also essential to include your home blood pressure readings in these discussions. Take your record to your medical visits or upload it to a patient portal when possible. Observing the trend, rather than just one measurement, enables your healthcare provider to determine what is effective and what isn't. If the readings vary, they can assist you in understanding the reasons behind this. Remember, mental and emotional health also play a significant role in this discussion. Stress, loneliness, depression, and anxiety can all contribute to increased blood pressure. Your healthcare provider might refer you to counseling, support groups, or community programs for assistance. If getting to the clinic is challenging because of mobility problems, distance, or issues with transportation, inquire about telehealth options. Numerous clinics now provide online consultations, facilitating easier contact from the comfort of your home. Effective communication doesn't necessitate lengthy discussions, merely sincere ones. Remember, your doctor is your ally in maintaining health, not a critic. The more informed they are, the better they can assist you. You don't need to wait for your next scheduled appointment. If something doesn't feel right, or if you have questions about a reading, a side effect, or altering your lifestyle, make sure to reach out. Your health is not a one-person effort, it's a team endeavor. Maintaining open dialogue is among the easiest and most effective strategies to safeguard your blood pressure and your long-term health. Handling high blood pressure need not be a daunting task. It doesn't demand an impeccable lifestyle, a long series of prohibitions, or perpetual anxiety. What it truly entails is consciousness of the everyday behaviors that count, the cues your body gives, and the influence you possess to mold your health with each choice you make. The reality is, blood pressure is more than just a numerical value. It mirrors how your body operates, whether it's active, resting, or reacting to the daily environment. Now, you've observed the 7 frequent errors that typically remain overlooked. Furthermore, you've gained insights on how to sidestep these issues. From comprehending your medications to monitoring your sodium intake, keeping physically active, handling stress, interacting with your healthcare provider, and making conscious decisions about caffeine and alcohol consumption. All of these are achievable, pragmatic adjustments that do not necessitate a complete transformation of your lifestyle. They encourage you to look after your health with a bit more regularity and a bit more purpose. We hold the view that strong health is established through one habit at a time. There's no need to tackle everything simultaneously. Begin by focusing on just one aspect. It could be monitoring your blood pressure consistently or replacing a salty treat with a healthier option. It might be setting an alarm to ensure you take your medication promptly or contacting your doctor regarding a concern that's been troubling you. Whatever it is, understand that every minor step you take is a step towards a healthier heart, a more stable life, and a more robust you. If you found this video useful, please like it, subscribe to the channel, and share it with someone who might appreciate some clarity and encouragement. Because when we back one another, we all emerge stronger, more stable, and better prepared to prosper, one heartbeat at a time.